Hello, and thank you for joining this American Veterinarian Peer Exchange on advances in small animal pain management. Osteoarthritis and other chronically painful conditions are alarmingly common in our veterinary patients. But in too many cases, these conditions go undiagnosed and untreated for far too long. Even acutely painful conditions don't always receive the attention they should in daily practice. We're fortunate to have safe and effective treatment modalities at our fingertips, and exciting new developments are on the horizon that might help us recognize and manage pain more effectively in our patients. In this peer exchange, we'll discuss some of these advances and how they might impact our approach to pain in veterinary practice. I'm Dr. Duncan Lascelles, and I'm a professor of surgery and pain management and director of the Comparative Pain Research and Education Center at North Carolina State University in Raleigh, North Carolina. I'll be moderating today's session, and participating today we have several distinguished members of our panel. Dr. Mark Epstein, Senior Partner and Medical Director of Total Bond Veterinary Hospitals and Carolinas Animal Pain Management in Gastonia, North Carolina. Dr. Margaret Gruen, Researcher at Duke University's Canine Cognition Center, Durham, North Carolina, and Adjunct Professor at North Carolina State University. Dr. Sheilah Robertson, the Senior Medical Director of Lap of Love in-home end-of-life care for small animals based in Gainesville, Florida. And Dr. Bryan Torres, Assistant Professor of Small Animal Orthopedic Surgery and Director of the Motion Analysis Laboratory at the University of Missouri in Columbia, Missouri. Thank you so much for joining us. Let's get started. So, Margaret, I'm going to start with maybe a question for you. We'd all like new therapies, but what are the most significant challenges to developing these new therapies?
Thank you, Duncan. I think that's a great question. I think some of the really significant challenges that we have are, one, in recognizing pain in our patients, educating owners about the presence of pain and the contributing factors, and then really having efficacious and validated tools to understand when they're in pain and when they're feeling better, so that we can really critically assess these new therapies.
So, and are there particular problems in the assessment when we're involving owners? I mean, people talk about the placebo effect. Is that an issue? Is that a problem in developing new therapies?
It's a big problem. So it's a problem in human health, and it's a problem in veterinary medicine. And in veterinary medicine, we even have a further issue, which is that we're one step removed. So we have some objective tools, but when we're asking owners about their pet's behavior and their pet's pain, we're asking them for their assessment of it. And these are people who may or may not have ever thought about what their pet looks like in pain before. And so we have layered in that their expectations, their hope for it to work, and all of that complicates our picture when we're asking owners about how their pets are doing. So we have what we call the caregiver placebo effect, where they believe that it's really effective when some of our objective tools suggest that it's not. And then maybe we actually even have an interplay where if they believe that it's effective and they interact with their pet differently, it is effective. So we have what we're starting to call the placebo by proxy effect as well.
And Bryan, you're involved in clinical research, looking at new, novel analgesics. What tools do you find are most effective in your hands?
Yeah, I think for me, I kind of think of how am I going to assess pain in these patients? And I kind of break it into what can I use to give me an objective measure and what can I use to give me more of a subjective measure. And I think they work really well together. So objectively for dogs, I really like gait analysis. I like looking at how they move, how they, how much weight they bear on a leg that may hurt. So a dog with, one-sided issue, maybe a cruciate tear or hip dysplasia in that left rear limb, how does that change pre and post treatment? Are they putting more weight on that limb? Is the range of motion changing in those joints? But I think you have to combine that with the subjective evaluations. We need to look at how these owners are assessing their patients at home, and I think that's important to make sure that we're using both of those methods. Now that's for dogs, right? So cats are a little different. They're a different creature. They are not dogs, and so Dr. Gruen here has done some excellent work with cats and how we might be able to assess their pain in a different way than getting them into the lab and trotting them over some force plates and pressure walkways and everything else.
You've used some activity monitoring, is that right?
Yes, so activity monitors are sort of the mainstay of what we've used for looking at efficacy. So we look for changes in a cat's activity over time. Cats have a wide variation in their overall activity levels, and so we really have to look at an individual cat and their change over time. They don't participate really well in our walkway studies. They don't enjoy coming to the veterinarian as much as we wish that they did. So activity monitoring at home has been really useful for us. But you're right, it really has to combine with what matters to the owner. So what improvement do we see in the activity monitor, and how does that actually translate to what owners think are better? Because maybe what they're really concerned about is whether he can jump up on the bed to watch television with them. So we need to balance what's important to the owner, what they notice as a clinical improvement, with what we feel is improved on any of our objective measures, I think.
And I think one of the things, just to kind of say one more thing, one of the things to consider, I think, is, for many, many years, a lot of the tools that we use to evaluate them as far as their gait goes were really limited to universities and large institutions. And that is somewhat changing now. We have more instruments and more technology that's available to private practitioners. And so, that hopefully will change in the coming years. But the subjective and the owner assessments are available to everybody.
But Sheilah, I just want to bring you in here because the owner assessments, I think, there are a couple of areas we haven't explored in owner assessments, particularly with respect to quality of life. Would you like to comment on that?
Yeah, so I think a lot of what we're talking about today is focused on osteoarthritis and the pain associated with that disease, and it is across a wide range of ages. But what we really are looking at, I think, is the quality of life for that animal and the impact that pain from the OA has on their life. But I don't know that all the tools should be disease specific, because if we think about some of the data that you and Margaret have published, if we actually look at the data, cats with osteoarthritis, over 70% of them are likely to have chronic kidney disease as well. And so there could be days where their chronic kidney disease is actually what's impacting on their quality of life more than the pain from their joints. So I think having health-related quality of life assessments, and then I think, with the new generation and technology that we have now, I really think that a lot of these new tools are going to have to be computer-based, iCloud-based, that the owner is sitting in their own home looking at what their dog or their cat is actually doing and answering the questions. Because I think when you get an insight to what's happening in the home, that it's very different from what you see when, especially with cats, when a cat comes to a clinic, they're not going to behave normally, and they're inhibited, they're scared. So I think in-home assessments, whether they're done via the owner, with a smartphone videoing and showing you, or whether they're sitting in their home assessing their animal, I think that is going to engage a lot more people in better assessments.
So it sounds like we have a number of assessment tools, objective, subjective, maybe measuring different dimensions impacted by pain.